Hello everyone, my name's Ashlyn, Sawyer, she, her, and I'll be discussing my practicum project to enhance environmental health performance measurement within Northern BC. Although my project was specific to environmental health, you'll see that the findings can be applied to other public health areas. So as I'm going through the presentation, I encourage you to consider the public health area you're working in or the area that you're hoping to work in the future. Before I begin, I'd first like to acknowledge with gratitude that my work took place on the land of 55 First Nation and 11 Métis chartered communities across Northern BC, as well as many Inuit, urban, and away from home Indigenous peoples. For my placement, I completed a joint practicum between the environmental health team of the Northern Health Authority in BC and the emergency management branch of the Public Health Agency of Canada. In anticipation of developing a performance system within Northern Health, the goal of this project was really to provide an overview of how literature in other jurisdictions measure the performance of environmental health programs so that Northern Health could take this and use it to adopt and create their own performance system. As some background, environmental health serves as one of the longest standing public health fields. Environmental health officers, also described as public health inspectors, protect public health by preventing, investigating, evaluating, and mitigating health hazards connected to both the natural and built environment. As experts, they complete activities such as public health regulation, enforcement, inspection, monitoring, surveillance, education, training, and sampling. They work closely with health authorities, government, business owners, operators, and the public. Knowing that health providers need to respond to changes effectively and efficiently, performance measurement is growing as a public health standard practice. So what is performance measurement? Well, it can be defined as the use of metrics and indicators, in other words, data, to track progress and success against specific program strategies, goals, and objectives. It's typically done to demonstrate accountability, recognize satisfactory performance, help establish those causal relationships between the work we do and the outcomes there are, track and make comparisons over time, allocate and prioritize resources, support decision-making, and help set future organizational, program, and public health goals. There are many different types of performance measures, and purpose of use is really varied depending on the context. It can be used to understand performance at kind of that system program level, as well as support individual and team level performance and public health research. A measure may be used to represent a target that a program has in relation to their local factors or in relation to a benchmark, regulation, or best practice. So an example of a benchmark may be that, say, like all high-risk food premises need to be inspected within once every 4 months. A target may be based on, resourcing, staffing, etc. that a program has, that 95% or 80% of these facilities would be inspected. For my practicum, I conducted a lit review and environmental scan. So there is a limited amount of research on my topic in particular. So the lit review examined more broadly key steps when developing performance measures for public health programs. A search was also conducted to identify measures related to Northern Health's core environmental health program areas. Potential contacts from government agencies and health authorities across Canada were also contacted, so more could be learned about their environmental health programs and areas, as well as their performance measures and activities. And lastly, their overall successes, challenges, and recommendations they had in respect to measuring the impact of their program. Of those contacted, 9 government agencies and 9 health authorities completed an interview. So in terms of findings, the literature described the process of developing a performance measurement system as both an art and science. So that means that it must flow systematically and be based on clear logic and objectives, while also being sensitive and flexible to the needs of the program and the people using it. Although there's no one right way to developing a performance system, the literature did highlight some key steps. Firstly, defining and aligning your program goals and your performance measurement goals to each other. ensuring that the program has the resources to support performance measurement, such as having the time to develop a system and collect data. Also, better understanding the culture of performance that exists within your team already. A big chunk of that is engaging stakeholders throughout the entire process to build and maintain buy-in and support, as well as ensure that your performance system is meaningful and representative. Developing a framework that outlines a methodology for connection and analysis between goals, objectives, activities, and measures. Here, logic models can be a really handy tool for performance systems. Next, identifying and selecting measures. So, although this is a really intuitive step here, the literature stresses that more measures is not necessarily synonymous to a better system. Time should be spent picking out those key indicators that are important and meaningful to the program and can actually be translated into action when interpreted. Next, what to do with that information, establish a data sharing plan and create a performance management plan. So there's some sort of process outlining how data is going to be shared and used. And then lastly, conducting a pilot and developing a process for quality improvement so that the system can be refined and improved over time. In terms of eScan findings, interviews highlighted various successes in implementing a performance system. Developing measures that have clear goals was mentioned, as well as placing quality assurance as a pillar in a strategic framework. Having those designated resources to support performance activities and standardizing policies and procedures so that data is of good quality and can be interpreted and compared. A buy-in and a willingness to change among the environmental health team was also listed. Part of this was using a participatory, evidence-based approach to developing measures, as well as having effective continuous communication and coordination among staff, as well as continuing to use informal methods to understand performance, especially as measures don't always capture the complexity, context, and circumstances a program or staff are working within. In terms of challenges, not having a clear or straightforward approach or strategic direction was mentioned. Another challenge was shifting priorities that place a demand on the program or the performance system. So these could be things like public health emergencies that need to take priority, or new policies and work that may not have clear guidelines and regulations in place. A lack of resources to support everyday program activities was also listed, as was the time it can take to develop and evaluate measures. Other challenges included the difficulty there is in defining appropriate measures and outcomes, as well as connecting program activities to public health outcomes. Determining how performance data will be accessed, used, and shared, and then communicating information about performance to others, such as explaining the work behind the data so that there's context behind the numbers. Interviewees provided the following as suggestions for those considering a performance system. And as you'll see, many of these overlap with the key steps identified within the literature, such as setting short, medium, and long-term goals and targets to work towards, cooperating and engaging with staff and stakeholders, and designating resources to support performance measurement. Also was highlighted was the need to conduct further research and evaluation on environmental health related programs, including more strongly connecting them and performance measures to public health outcomes. Lastly, interviewees recommended that there be more thoughtful consideration about how performance data will actually be mobilized into action. So on the screen here is a quote that I really liked from someone that I spoke to that really drives home that mobilization piece. A term I like to use with staff and others is, okay, so what? I did 10 inspections. So what, you did 10 inspections? What did those 10 inspections tell you? What did you learn from them in terms of data and output and evidence? What are you going to do with that information? What's your intervention going to be? It seems rather simplistic, but we need to move further along that continuum rather than just the counting. So overall, this work provided some evidence-based steps to developing a performance system, as well as filled the knowledge gap there is on environmental health performance with research that's representative of programs across Canada. Future research may wish to more deeply examine or consider what measures may be best representative for specific programs and activities, which measures and activities are most strongly associated with public health outcomes. A key one here is how we support the coordination and standardization of performance measures while also recognizing the individuality, context, resources, strengths, challenges, and populations served among specific programs. And lastly, how do we better mobilize performance data to improve public health and health equity? Before I close, I'd firstly like to just give a special thanks to my practicum supervisor, Kyra Horning, and the entire environmental health team at Northern Health. I'd also like to thank the Public Health Agency of Canada, the University of Victoria, and of course the environmental health programs across the country who took the time to speak with me. Thank you.